KSMQ Health Connections, local healthcare providers answering your medical questions. This week's topic, forgetting and caregiving.
Good evening and welcome to KSMQ Health Connections, where we connect you with some of the finest minds in the medical field. I'm Eric Olson with KSMQ Public Television. Thanks for tuning in. Tonight, a difficult topic, caring for people with Alzheimer's and dementia. It's difficult because people are so afraid of dementia in many cases, they don't even want to talk about it. Difficult because so many of us have a spouse, a parent, a relative, or friend who has dementia, and dealing with that can be a very heavy burden. We're going to talk about dementia and caregiving tonight with two people who have experience with helping patients and their families. There is support out there. We're going to talk about that in a little bit, but first let's start with some numbers. Most common type of dementia, Alzheimer's. 5 million Americans suffer from the condition. It's the 6th leading cause of death, more than stroke, more than diabetes. And for those over the age of 65, 1 in 3 people die with Alzheimer's, some type of dementia, 1 in 3. Those numbers are about the patients, but there are numbers about the families of patients also. 15 million Americans are caregivers for people with dementia. We're talking family members and friends, not paid staff. Each year, it's estimated they devote 18 billion hours caring for their loved ones. It's a huge burden, especially when you consider that a typical patient with Alzheimer's lives 8 to 10 years after being diagnosed. So we have a lot to talk about, unpack. We invite you to be part of the conversation. Give us a call right now, live Tuesday in Austin, 888-255-0121, or you can email us, healthconnections@ksmq.org. Before we start the conversation, we think it would be helpful to give you a few basics on the biology of Alzheimer's. So take a look at this 2-minute video produced by the National Institutes of Health.
In healthy people, all sensations, movements, thoughts, memories, and feelings are the result of signals that pass through billions of nerve cells or neurons in the brain. Neurons constantly communicate with each other through electrical charges that travel down axons, causing the release of chemicals across tiny gaps to neighboring neurons. Other cells in the brain, such as astrocytes and microglia, clear away debris and help keep neurons healthy. In a person with Alzheimer's disease, the most basic form of dementia, toxic changes in the brain destroy this healthy balance. These changes may occur years, even decades, before the first signs of dementia. Researchers believe that this process involves 2 proteins called beta amyloid and tau, which somehow become toxic to the brain. It appears that abnormal tau accumulates, eventually forming tangles inside neurons. And beta amyloid clumps into plaques, which slowly build up between neurons. As the level of amyloid reaches a tipping point, there is a rapid spread of tau throughout the brain. But tau and beta amyloid may not be the only factors involved in Alzheimer's. Other changes that affect the brain may also play a role over time. The vascular system may fail to deliver sufficient blood and nutrients to the brain. The brain may lack the glucose needed to power its activity. Chronic inflammation sets in as microglial cells fail to clear away debris, and astrocytes react to distressed microglia. Eventually, neurons lose their ability to communicate. As neurons die, the brain shrinks, beginning in the hippocampus, a part of the brain important to learning and memory. People may begin to experience memory loss, impaired decision-making, and language problems. As more neurons die throughout the brain, a person with Alzheimer's gradually loses the ability to think, remember, make decisions, and function independently.
That video from the National Institute on Aging, which is part of the National Institutes of Health. Now we're going to talk about how people with dementia can live better, and just as importantly, how the people around them can live better. Dr. Cory Ingram is Director of Palliative Medicine and Population Health at Mayo Clinic, also with the Mayo Clinic Health System. Southeast Minnesota Medical Director Richard Wood on the far side of the set there, Certified Nurse Practitioner, Mayo Clinic Health System, Albert Lea. Welcome to you both.
Thank you.
Doctor, can we start a little bit, just a global view of Alzheimer's, dementia? What different kinds are there?
Oh, I'm glad you asked the question. I think the terms Alzheimer's and dementia get confused sometimes. And I actually go back to the video that you just showed. I thought it was helpful for the audience to hear, because it mentioned that there's Alzheimer's with the amyloid causing the problem, but also the blood vessels causing trouble. I think that helps divide dementia into two main classes. Alzheimer's on the one hand, and blood vessel type dementia on the other hand. Vascular, yeah. Mm-hmm. And sometimes the two go together, but I think those two large categories represent the overwhelming majority of dementia. And there's also some other types that are not as common, but people will have those in our communities, like Lewy body dementia, Parkinson's related dementia, frontal temporal lobe dementia. Those are a little bit different and a smaller population. So I think when you first asked that question, for most of the viewers in the community, thinking of Alzheimer's as one type and then the blood vessel or vascular dementia as another type are really the two large categories of dementia. And it's helpful to think about those.
And history-wise, have we always known about this? I mean, it seemed in my lifetime, it almost was when President Reagan wrote that letter to the American people way back in 1994, I think, talking about I have Alzheimer's. Yep. That was kind of the first a lot of us knew about it, or at least I shouldn't speak about everyone, but for me it was. Has it been around long before that, or are there factors in our world today that's making it more prevalent?
So that's a great question. It was the Alzheimer's diagnosis and the condition was actually diagnosed back in I think 1905 was when the original. Wow. Yeah, when the original case was described by two different physicians, and they started to recognize these changes. But to your point, if you think about how people over the last 5 or 6 decades have come to the end of their life. 50 years ago, 60 years ago, it was very common for people to die of something quite sudden. You know, they'd have a massive heart attack and they would die shortly thereafter. The time between a major health event that would take your life and the end of life was short, maybe a few weeks, and people didn't live as long. Today, people are living much longer.
So there's more of these.
And so we see the disease much more often. And it's hard to find people our age that don't have a loved one affected by this.
Thank you. Mr. Wood, what does that look like on the ground here in Albert Lea in our Austin area? You have facilities there. How many people, how many patients do you service in your units?
There's a great number of people in the different nursing homes, and dementia is one of the most common problems there. The Alzheimer's dementia is quite prevalent. It is the most common. There's quite a bit of mix when you get into the nursing home population just because of all the other comorbidities that go with it. So you really do get a big mix. But
so do you travel as part of your service from location, from facility to facility, helping people, helping their families?
Right, that's what I do. I do the hospice visits both in Albert Lea and Austin area. And then I do primarily nursing home rounds in Albert Lea area. So it really is a fairly large, it's like almost 500 nursing home beds that I covered for quite a while.
Difficult for you to see all that suffering, I would imagine.
It is difficult, but that's one of the reasons that I went into this to begin with, is because there are ways to ease some of the suffering. It's one of those things you can't cure, but you can certainly make things easier for the individual that's going through it and for the families.
Sure, and you're helping with that. That's great.
Yeah.
As I mentioned, we have some RNs taking your calls and emails. One of them, Jen Gallagher works at Sacred Heart Care Center, graduate of the nursing program at Riverland Community College in Austin, and our phone line is busy already. Jen, you have a question?
Yes, we are. We have a few questions, but the first one was actually an email from Jonathan in Albert Lee. Jonathan's wondering, he's heard some research suggesting that chronic lack of sleep could lead to Alzheimer's. He's wondering if there's any truth behind that.
Chronic lack of sleep. Doctor, is that in the literature?
You know, I'm going to be honest with you, Jonathan. I don't know the answer to that question. I think to Jonathan's question in a broader, I don't know, Richard, do you know?
I have heard of them doing the research on that, or they've noticed an association, but not entirely sure if that's entirely the cause. But people who have less sleep, I believe it was less than 4 hours a day, do tend to have higher incidence of Alzheimer's.
Probably not valid, or it's not validated, that kind of research.
It's not validated, and you don't know for sure if it's
reached your
actual
world,
cause
doctor.
and effect.
It could be that I haven't read about that, quite honestly. But I think Jonathan's question is a good question, because you could say, well, how do I prevent myself from getting these diseases, right? Well, there's something we can do. And I think to Jonathan's question, one is getting good sleep and taking care of our brain, using it.
That can help.
Reading and exercising your brain. And I think sleep is probably a good part of that. But
and
I'll be honest, I haven't read the study on that.
Exercising the body as well.
Yeah, my mom is 95, and she does a lot of those online mental things that they have out there now.
That's right.
Jen, you have another question.
Yes, I do, actually. One was answered. It was about lifestyle and nutritional modifications with a history of Alzheimer's. Jennifer from Albert Lee called, and she is wondering, what advice do you have for families when it comes to working with care facility staff when a family member is transitioning to a newly admitted skilled care facility?
That's a good question. You want to take Richard, you want to take it?
It's a tough situation, because people with Alzheimer's, dementia, don't transition well to anything. So that really does make it difficult. And it is good for family members to let the staff know in the places if there are certain things that tend to trigger difficult issues or behaviors, or if there's anything that the person likes that helps calm them down. Some people like music more, some people prefer activities. And the family can help
family can help by telling the staff, and that can help with the transition some, yes.
All right. Richard Wood, certified nurse practitioner, Mayo Clinic Health System. Dr. Cory Ingram, director of palliative medicine, population health at Mayo Clinic, also with Mayo Clinic Health System, talking about living with dementia. 1 in 3 Americans over the age of 65 die with either Alzheimer's or some other type of dementia. Cost to the healthcare industry runs into the hundreds of billions of dollars each year. Personal cost to the families, hard to measure. If someone you love is suffering from dementia and you have a question, we've loved the questions. Keep calling or send us an email, 888-255-0121. And we're back talking about dementia, talking about Alzheimer's with our experts from Mayo Clinic Health System, taking calls from our viewers, and Jen Gallagher has another call.
Yes, I do. A family member has been dealing with caregiving in-home for quite a few years since a diagnosis. She is wondering, is there any advice or anything that you should look for when you're researching skilled care facilities for someone to go to? Is there any recommendations or any hints that a family member should be looking for when they're transitioning to that point with a loved one?
Yeah.
Any suggestions, Dr. Richard?
Have at it.
So this is a really important question. Who asked the question again?
They didn't give me a name.
No name. So whoever asked the question, I think it's a wonderful one. It's one of the biggest decisions a family has to make when they've been caring for somebody at home and transitioning. I think it's about research and very personal research. Going and seeing the facilities, talking to the facilities about how they care for people. And I think one of the questions to ask a facility is, tell me about a situation in which my loved one, my mother, my father, my wife, my husband, tell me about a situation in which they could no longer live here. That's a question I would ask a facility.
So how far in the continuum
Yes.
are you able to care for my loved one?
Yeah.
Oh.
I would ask them that question. I would ask them the question, tell me how you care for my loved one after hours. If they're having problems with shortness of breath, or if they have pain, tell me about the, who cares for them after hours. I think those are important questions. I think the other thing to do is not only interview the facilities, but interview families. And you could ask the facility, would there be any families that I could talk to of patients that you care for? And they won't give you those people's names, but they might ask those people to call you.
Oh.
And then you could ask them, tell me about how your loved one is cared for. And so you're doing the research, you're talking with friends and neighbors, but also professionals. And so you could also ask a local nurse, for example. Because community nurses know where
Okay.
care.
Richard's nodding your head there.
Yeah. So
They do. It's part of their job is trying to figure out best place or best placement even at times for somebody. And they kind of have a pulse on what's
what
going
skill
on.
sets are best for which facility or
That's right.
that. Okay.
And you could even ask them, you could ask the facility, tell me about how you might care for somebody with this type of dementia if that's specific to your situation. Do you have people like this? How do you respond to falls? How do you respond to, what do you do to prevent falls? How do you help my loved one eat well? Do you have people to help with that? All those sorts of questions that may be important. And I guess I'm giving a few questions, but I would encourage a family to really see it as an interview. I'm going to go and interview this facility, and I'm going to interview that facility, and I'm going to talk to some other folks.
Great stuff.
Do your homework.
Great input from both of you. Thank you very much. Jen, take it.
Yes, hi. Randy from Rochester. He had a concussion a year ago, still suffering from the side effects of that. Could this lead to Alzheimer's or dementia?
So head injury trauma, does that present for Alzheimer's or dementia?
Oh, I would suggest.
I mean, without talking
with Randy,
about that
yeah.
specific case, we always say that. So,
Yeah,
does it happen?
It does. So people who have had brain traumas are at an increased risk. It doesn't mean that it will happen, but they're at an increased risk for development of memory problems. And so the answer is it does put you in a little bit higher risk. But I think having one concussion is probably on the lower end of the risk than if you'd had multiple.
Maybe check it out with your healthcare professional.
Ask your neurologist.
You're concerned about it.
Yes.
Okay, great. We still have about 7 minutes to go. Time for you to call, email your questions, 888-255-0121, email healthconnections@ksmq.org. All right, we're back here, and Jen has more input. Lots of calls.
Yes, I'm going to actually combine two questions. So Mary from Mason City called. She's wondering, how was Alzheimer's diagnosed? Is it a blood test? And then piggybacking off that, they did not give a name, but at what point in dementia would somebody likely be accepted under hospice care? And what are those signs a family member should be looking for or that a healthcare professional looks for?
Okay, there's a word hospice we haven't really dealt with in our show, but first, blood test or diagnosis, is there a test for Alzheimer's, Doctor?
Yeah, so Mary's question is a very good question. And should I look at this right to you, Eric?
Absolutely.
Yeah. So Mary asked a question about how to diagnose it. And it's a clinical diagnosis. And there are some blood tests that are oftentimes done, but they're only to rule out other things.
Oh.
So the test is really a clinical test where a clinician will sit down and just ask the patient a series of questions to see how their memory is in various aspects of their memory. Can they recall things? Can they draw particular objects? Can they do some calculations? Things like that. And based on the story that the patient and family share, plus some of the clinical testing, along with a physical exam, that's usually enough for the clinical diagnosis. Oftentimes, some images are taken of the brain, so that like a CT scan or MRI, and sometimes some blood tests are done as well.
And you can plot them on a scale. There's a scale, is there not, of progression?
You can stage
or
it.
of the
Yes.
so that you know if you have these symptoms, might be this far.
You're exactly right. And I think Mary's question was, because I think Mary's saying, when would we know when we need hospice?
Yeah.
Yeah. You want to speak to that, Richard?
Yeah, Richard,
but
what do you think?
Well, actually, you're probably better at the fast scale than what I am, but there are certain markers or certain areas, because it is a progressively degenerative disease, and you do just gradually lose different functions. So there is a certain point where most people, when they've gotten to that level, then they would be considered appropriate for hospice care.
Are there online tools? Can a lay person access it and make that to answer the hospice question, or is that something we shouldn't be? We should just leave it in the hands of the healthcare professional for looking at the scale. And her question was specifically about hospice.
Right, and I think a lot of times if family members would look at that, they'd find that people that they're trying to care for probably have qualified long before they thought they did.
Ah, okay.
Just because you're trying to continue to take care of someone.
Okay, Jen?
Yes, I had a question from Lacey in Albert Lee. She's wondering, she's heard some talk about hospice care, but then also palliative care. And what is the difference, and how does it, or does it pertain to Alzheimer's dementia?
It's in your departmental title. I should have. I guess I should have asked about it. Sorry about that.
So I think one of the ways to look at it is that there's about 43,000 people in the state of Minnesota each year who die. Of those 43,000, most of them would benefit from hospice care, because hospice is a team of professionals who care for people who are near the end of life, usually in the last 6 months of their life. So if 43,000 people die in Minnesota each year, about 200,000 people in Minnesota will die in the next 5 years. A lot of those patients and families would benefit from palliative care right now.
Which is what?
So it's a similar team of doctors and nurses and social workers and massage therapists and music therapists working to provide the best quality of life for people who have an illness that's not necessarily getting better, and they're slowly starting to decline. So prior to hospice, in the last years of life, that team would focus on enhancing the quality of life of that patient.
It's a treatment option, or
total treatment option.
Do you interact with those folks?
I don't officially interact with palliative care. I actually tend to do some palliative medicine in the nursing homes as well.
I bet you it's very helpful for those patients to keep them comfortable.
Yeah.
Jen, another question? You still have one?
Nope, I do not. They've all been answered through the
Wow.
Yes, I know.
You've
Wonderful.
answered all the questions. I wish I had a bonus prize for you.
Can I go back to Mary's question?
Go back to Mary's question, and we want to talk about research too.
So for Mary in Mason City, I think the question that she needs to wrestle with is, how do I want to respond to my loved one's crisis? Because if Mary is caring for somebody who has dementia, most likely that individual has had some crises, and it's making her think about, when do I have hospice? And I think one of the fundamental questions that Mary needs to think about herself and talk with her family about is, how do we want to respond to our loved one's next crisis, meaning next pneumonia, next urinary tract infection, those sorts of things. Because as in your video said, many people will die from dementia. It's the sixth leading cause. And so for Mary, she's got to wonder, well, what will my loved one die from? Or what do these people die from?
So thinking in advance about where you're going to go.
Yeah, because the people with dementia will die from a common infection.
Okay. Thank you very much, both of you gentlemen. We're out of time. So informative. Thanks to Dr. Cory Ingram with Mayo Clinic Health System, and also Richard Wood with Mayo Clinic Health System. And thank you for joining us. Great questions tonight. A special thanks, a shout out to our RNs who've been taking your calls this season, Jen and Laura. Where's that Santa hat? You're supposed to be wearing that. Thank you so much. And most of all, we want to thank you for those who called, sent emails. Thanks for watching. Have a great holiday.